The answer is C. By secretion. Disclaimer: this online video lecture is for educational purposes only and may contain omissions or inaccuracies. The information provided is not intended to be a substitute for professional advice. Viewers acknowledge and accept that the speaker and any associated organizations are not responsible or liable for any errors or omissions or for any actions taken based on the information provided. Let us begin. Number 1. Hyperthyroidism is commonly known as which of the following disorders? A. Addison's disease. B. Buerger's disease. C. Cushing syndrome. D. Grave's disease. The answer is D. Hyperthyroidism is known as Grave's disease. Addison's disease is a deficiency of cortical hormones. Cushing's syndrome is an excess of cortical hormones. Buerger's disease is a recurring inflammation of blood vessels in the upper and lower extremities. Number 2. Which of the following forms of severe hyperthyroidism is life-threatening and produces high fever, extreme tachycardia, and altered mental status? A. Hepatic coma. B. Myxedema coma. C. Thyroid storm. D. Hyperglycemic, hyperosmolar non-ketotic syndrome. The answer is C. Thyroid storm, also known as thyroid crisis or thyrotoxicosis, is a form of severe hyperthyroidism that can be precipitated by stress, injury, or infection. Hepatic coma occurs in clients with profound liver failure. Myxedema coma is a rare disorder characterized by hypoventilation, hypotension, hypoglycemia, and hypothyroidism. Hyperglycemic, hyperosmolar non-ketotic syndrome occurs in clients with the type 2 diabetes mellitus who are dehydrated and have severe hyperglycemia. Number 3. Secretion of thyroid-stimulating hormone, TSH, by which of the following glands controls the rate at which thyroid hormone is released? A. Adrenal gland. B. Parathyroid gland. C. Pituitary gland. D. Thyroid gland. The answer is C. By secretion of TSH, the anterior pituitary gland controls the rate of thyroid hormone released. The adrenal gland isn't involved with the thyroid gland. The parathyroid gland secretes parathyroid hormones, depending on the levels of calcium and phosphorus in the blood. The thyroid gland secretes thyroid hormone but doesn't control how much is released. Number 4. Which of the following disorders can cause a client to retain fluid and develop hyponatremia secondary to the inability to excrete dilute urine? A. Thyrotoxic crisis. B. Diabetes insipidus. C. Primary adrenocortical insufficiency. D. Syndrome of inappropriate antidiuretic hormone secretion. The answer is D. Syndrome of inappropriate antidiuretic hormone secretion is a condition in which the client has excessive levels of antidiuretic hormone, ADH, and can't excrete the dilute urine. Therefore, the client retains fluids. The disorder causes a dilutional hyponatremia. Diabetes insipidus creates an ADH deficiency, causing adrenocortical insufficiency. Addison's disease is caused by deficiency of a cortical hormone. Thyrotoxic crisis occurs with severe hyperthyroidism. Number 5. Diabetes insipidus is a disorder of which of the following glands? A. Adrenal gland. B. Pituitary gland. C. Parathyroid gland. D. Thyroid gland. The answer is B. Diabetes insipidus is a disorder of the posterior pituitary gland. Number 6. Laboratory findings indicating decreased levels of glucose and sodium and increased levels of potassium and white blood cells would correlate with which disease? A. Addison's disease. B. Cushing syndrome. C. Diabetes mellitus. D. Hypothyroidism. The answer is A. Low levels of glucose and sodium, along with high levels of potassium and white blood cells, are diagnostic of Addison's disease. Number 7. Which of the following nursing interventions should be performed for a client with Cushing syndrome? A. Suggest clothing or bedding that is cool and comfortable. B. Suggest consumption of high-carbohydrate and low-protein foods. C. Explain that physical changes are a result of excessive corticosteroids. D. Explain the rationale for increasing salt and fluid intake in times of illness, increased stress, and very hot weather. The answer is C. Clients with Cushing syndrome have physical changes related to excessive corticosteroids. Clients with hyperthyroidism are heart intolerant and must have comfortable, cool clothing and bedding. Clients with Cushing syndrome should have a high-protein, not low-protein diet. Clients with Addison's disease must increase sodium intake and fluid intake in times of stress to prevent hypotension. Number 8. A client with Cushing syndrome is placed on a low-sodium, high-potassium diet because A. The use of salt probably contributed to the disease. B. Excess weight will be gained if sodium is not limited. C. The loss of excess salt in the urine requires less renal stimulation. D. Excessive secretions of aldosterone and cortisone cause renal retention of sodium and loss of potassium. The answer is D. Clients with Cushing syndrome must limit their intake of salt and increase their intake of potassium and excreting potassium. An excessive secretion of adrenocortical hormones in Cushing syndrome, not increased or high sodium intake, is the problem. Although sodium retention causes fluid retention and weight gain, the need for increased potassium must also be considered. Because of steroid therapy, excess sodium may be retained rather than excreted. Number 9. A client is admitted with the diagnosis of primary hyperparathyroidism. The nursing action that should be included in this client's plan of care is the A. Provision of a high-calcium diet. B. Assurance of a large fluid intake. C. Institution of seizure precautions. D. Maintenance of absolute bed rest. The answer is B. Fluids help prevent the formation of renal calculi associated with high levels of serum calcium. Additional calcium intake could raise already high levels of serum calcium. Seizures are associated with low, not high, levels of serum calcium. Rest is contraindicated because bone destruction is accelerated. Number 10. Coarsening of facial features and soft tissue swelling of the hands and feet are early clinical manifestations of which of the following conditions? A. Acromegaly. B. Cushing syndrome. C. Graves' disease. D. Pheochromocytoma. The answer is A. Acromegaly is marked by coarsening of facial features and soft tissue swelling of the hands and feet. Cushing syndrome causes thin extremities, truncal obesity, and a moon face. Graves' disease causes bulging of the eyes, weight loss, and heat intolerance. Pheochromocytoma is a tumor of the adrenal gland that causes hypertension. I hope you learned something from this video. Please visit www.texams.com for more nursing information. Texams. The ease of information.